Well, faced with some multiple crises, of course, on the electricity generation front, and also what has been a very slow rollout of vaccination, and Bernstein has been weighing in on the issue and questions whether South Africa is in crisis. And good evening to you. Before I get to just your take in terms of where you believe we are as a country, I imagine this afternoon's news you will meet with joy, because you've been talking about reforms that need to be implemented by government, and electricity is one of the crucial ones.
I think the president did a bold thing today, and he should be commended by everybody. He took the country by surprise. He didn't just move it to 50 megawatts, but to 100. And we need more bold decisions like that to signal his seriousness about reform. And that's really what I'm saying with respect to a new health minister.
What do you think a new health minister would need to do? And is there a particular individual that you have in mind?
Well, look, just think for a moment, Kathy. We're in the midst of a pandemic. A third wave is engulfing us. Our hospitals are in a very bad state pre-COVID. Our health system is not working well. We have one of the worst vaccine rollouts in the world. We're one of the lowest in Africa. And in this context, people's lives are at stake. So this is no simple matter. And I'm saying the stepping aside of the current Minister of Health gives the president a big opportunity. Surprise us all. Pick the best person in the country to run the health department, to lead the vaccine rollout, and build a team to rebuild our health infrastructure in the middle of this terrible pandemic, and perhaps we can save some more lives.
The best person in the country, and may not necessarily be part of the ANC or even be part of the current executive. I'm not saying that there isn't a person in the executive that would not be among the best, but I'm saying, are you saying that the president should look beyond just the structures of the ANC to find a new health minister?
Absolutely. I'm saying we shouldn't be looking at the bottom of the barrel for yet another person who hasn't got the experience to run a very large system and to build a team in the midst of a crisis and run a complex vaccine rollout. The president should look beyond the ANC. He should think about country, and he should find the best person for the job. And I'm emphasizing people's lives are at stake. He has a perfect excuse for all his opponents, because he can say, do you not want the best person in the country to save South African lives? That's what I'm calling for.
Do you think that some of the officials that have formed part of the ministerial advisory committees, whether it's on government's response to COVID or even on the vaccination plan, would be a good place to start?
Well, if I were the president, I would be reaching out to the private sector, to the trade unions, to civil society, and say, tell me your assessment of the best person to run and lead our health department at this terrible time for South Africa. Who do you think? So he should consult widely, which he's good at. He should ask for suggestions, and I'm sure they will be forthcoming from different parts of our society. And then he could make the right and bold decision for the country at this very difficult time.
Executive Director from the Center of Development and Enterprises, Anne Bernstein. And let's leave it there for tonight.